Ventilators need different modes because patients have different breathing needs, medical conditions, and levels of lung function. Why do ventilators have different modes? Ventilator modes are like settings that control how and when the machine helps a patient breathe. Pushpin main reasons for different modes. 1. Brain different levels of patient awareness. Some patients are awake and can breathe a little on their own. Others are unconscious or very weak, needing full support. 2. Dashing away varying lung conditions like asthma, pneumonia, COVID-19, or ARDS need different types of airflow and pressure. Some lungs are stiff, hard to expand. Some are floppy, easy to overinflate. 3. Red heart adhesive bandage recovery stage. In early stages, patients may need full support. As they improve, the ventilator gives partial help to encourage the patient to breathe on their own. 4. Chart increasing control oxygen and CO2 levels. Some modes help remove carbon dioxide better. Others give more oxygen if the patient is low on it. Hammer and wrench common ventilator modes. Basic overview. Mode, what it does. Example, use CMV, controlled mechanical ventilation. Machine gives all breaths for patients who are unconscious. AC, assist control. Machine helps with each breath, even if patient tries for weak patients. SMV, synchronized intermittent mandatory ventilation. Mix of machine and patient breaths for weaning, recovery. CPAP, continuous positive airway pressure, no breaths given, just pressure support for mild breathing issues or sleep apnea. Direct hit. In short, ventilators need different modes to match the patient's needs, avoid lung damage, help the patient recover safely.